Did you know that nearly half of all adults in the U.S. have turned to complementary and alternative medicine at some point in their lives? Welcome to the Best Kept Secrets in Healthcare, your ultimate gateway to discovering revolutionary health solutions beyond the boundaries of traditional medicine. Your host, Dr. Ray Drury, has decades of experience in alternative medicine and is here to guide you through endless possibilities and natural drug-free pathways to vitality. In each episode, he'll delve into insightful conversations with visionaries and change agents who are redefining healthcare paradigms. Break free from healthcare limitations and elevate your well-being. Whether you're eager to learn about holistic healing, non-invasive remedies, or cutting-edge complementary medicine, the Best Kept Secrets in Healthcare reveals all. Join us as we uncover the natural health wisdom the world needs. Stay ahead in your wellness journey. Subscribe now to the Best Kept Secrets in Healthcare wherever you podcast, because your well-being isn't just health, it's a revolution.
All right. Well, welcome to another episode of the Best Kept Secrets in Healthcare. And so today I brought in a special guest, Dr. Kevin Broom, and because I want him to share with us actually one of the best kept secrets when it comes to Meniere's disease. A lot of people suffer from Meniere's disease, and a lot of them feel like they have no hope. They've been to their medical doctors, ENTs, and have had very little help, and oftentimes the recommendations are pretty extreme, even to the point of like killing the inner ear, doing nerve blocks, stuff like that. So our guest, Dr. Kevin Broom today. Kevin, or Dr. Broom, I should say, welcome to the show.
Thanks for having me. Looking forward to the conversation.
Yeah, so the reason I wanted you to come on the show, so you can kind of share with us a little bit about your journey. I know having Meniere's disease at an early age kind of changed the whole direction of your life. For one, it was a struggle, but then by overcoming the struggle, it kind of changed the whole direction. And I want to know how that's affected you, how it's affected your family. But a lot of people, a lot of our audience has maybe not heard of Meniere's disease. They've heard of the symptoms, obviously. Can you give us a little description, like what exactly is Meniere's?
Sure. Meniere's really is just a collection of symptoms for the majority of people. And every single Meniere's case that I've seen, and I've seen hundreds in the office, and even what I experience, everybody's different. And so a lot of people will actually call it a syndrome. So usually it's just one-sided, so like right ear versus left ear. But some people will experience lightheadedness or a constant just dizziness type situation. For me, I had drop attacks. So it was just violent vertigo sessions where you couldn't even really get grasp. You just had to immediately kind of fall. So vertigo, dizziness, tinnitus, that constant ringing in the inner ear. People experience fullness over that affected ear side. And so like anybody can kind of fluctuate in and around all of those. So some people will just have hearing loss when it comes to their Meniere's, and some people will have tinnitus and fullness. And then
Right.
for me, it was kind of all the above, the drop attacks, I would wake up in the morning just completely deaf. And then by lunchtime, I'd have normal hearing again. I'd be deaf by dinner again. And so those drop attacks can affect you for days because you just get extremely fatigued and tired. And then the hearing could go away for days on end, and then it could come back and you'd have normal hearing. And so the syndrome of Meniere's is just that. It's the collection of those symptoms of vertigo, dizziness, lightheadedness, tinnitus, or that ringing in the ears, the fullness, the hearing loss. And so from like an anatomical perspective, they don't really know what causes it. They think they have an idea, but for everybody, it's just just this weird collection of symptoms, and each individual is going to be on their own.
And now you get a lot of people in your office, I know I do, that maybe have the triad, right? The dizziness, ringing in the ears, loss of hearing, but they've never actually been like diagnosed and never put a name on it, which really, I mean, really, it's just a name. Some Dr. Meniere, I read up about this years ago. Some Dr. Meniere said, hey, these people have 3 symptoms. We're going to put my name on it and call it the Meniere's disease or the Meniere's syndrome. But a lot of people come in and they have those symptoms, but never really had a name put on it, right?
Absolutely. And I tell my patients all the time that a a name does nothing but just kind of identify that. That's it. And
Right.
so even though you get a quote unquote diagnosis of Meniere's, you're still experiencing the same exact symptoms. Nothing changes in your life. You're still getting
Yeah, that whole diagnosis thing is kind of a joke anyway, right? They just follow a flow chart of you have this, you have this, you have this. Well, we're going to call it that, right? But then what do? They still just treat it symptomatically, right? They're going to try to give you some drug to cover up the symptoms short
Right.
term.
And so Meniere's really is, and I tell people all the time, there's a lot of conditions out there that are like rule out conditions. All right. So you're dealing with drop attacks and hearing loss and fullness in your ear. And so step one's like, okay, sounds like Meniere's disease, but let's rule out this, this, this. And then all of a sudden you're left with, oh, you have Meniere's. And we kind of knew that going
Right.
into it, but we had to just rule out that the other potential causes. But yes, it's just a people will, and I'm sure you've experienced this in your office. People will come in and they've tried everything, or you're their first step and
Right.
trying to identify it. But there's a lot of people out there who experience those conditions, but yeah, they've never been labeled Meniere's disease.
Yeah. So your story, you started early in life.
Yep.
So tell me a little bit about how old were you? What was it like when you were growing up? What you went through? You know, the avenues that you tried. You know, to get you to the point of where you are.
Yep. So I remember it just as clear as it can be. But um, my bed was on these colored blocks, and it was Christmas Eve, my fifth grade year, and my brother and I, he's 4 years older than me. We had a routine of we would alternate where we slept on Christmas Eve. So this year it was my time. So he crawled into the floor right next to my bed, made a pallet, and so we were sleeping in the same room for Christmas Eve. And I ran. I went to the bathroom and I ran and I kind of jumped over him and landed in the bed on a mattress. I've done it, probably every night going to bed. And so, but when I landed, just boom, everything just started spinning. And I told my
Hmm.
mom, I was like, I'm dizzy. And she's like, oh, it's just Christmas Eve. You're excited. You're anticipating Santa Claus coming. And so I laid there and just battled this. Heart was just beating out of my chest. I couldn't really focus. Um, Hot, just sweating under the covers. And my brother's down on the floor, and he's like, dude, just calm down. Like, just go to bed. We'll wake up. And then probably an hour and a half after I went to bed, just right out of the bed and just vomited all over my brother.
Oh
And
boy.
and so I spent the next probably 2 hours in the bathroom floor and vomiting in the toilet and trying to get calmed down. And mom was just, back in the day, it was sip this ginger ale, cold cloth on your forehead. Finally
Hmm.
went to sleep, woke up the next morning and just exhausted. And that's a typical Meniere's attack. It's just you have that attack, then you get it to calm down, and then your body is just, if it's the adrenaline rush or whatever, but you just burn through those storages and you're just exhausted. And so we went to pediatrician. The next available moment, we had 2 or 3 day Christmas break or whatever, and his wife had actually just been diagnosed with Meniere's disease, and he said it sounds like Meniere's disease. It's exactly what my wife went through, and so he started that. Let's get you to a ear, nose, and throat doctor, and we started with one in Charlotte, and great doctors. They were caring. They They were good people. They were nice, but they did what they did. They were seeking that diagnosis and treatment of the symptoms that we talked about earlier. And so, um, I want to say step one was steroids to try to combat the inflammation, and I think that's pretty standard for the majority of people. But um, I actually can't remember my second attack. Um, Mom and I have talked about it, but I think I was 11, fifth grade, somewhere around there. They the hearing started to become an issue, and so the hearing probably affected me personally more than the vertigo, just because of fifth, sixth, seventh grade, waking up, can't hear, going to class, kids making fun of you. You don't know, you can't talk on the phone, that kind of stuff. So um, they started to enhance the treatments a little bit, and they did some calorics where they put water in your ear and try to recreate the uh, the Meniere's attack or the vertigo. They did an MRI, but the attacks just kept getting worse. And every time we'd have an attack, Mom would take me to the pediatrician, or she'd take me to the ENT. I bet I've had 200 audiograms
Mm.
throughout my childhood, but it was just a point where I was actually having these drop attacks probably every 24, 48 hours. At its worst, I want to say it was 250 plus drop attacks in a single year. Um, Predominantly right-sided, but I was lucky enough to be the kid that got Meniere's, but I also had it bilaterally. So they started to pick up on some left ear Meniere symptoms. And so the it just started to just increase no matter what we did. Diuretics, steroids, low salt diet. Um,
Mhm.
I mean, it's just it got pretty brutal and depressing. Honestly, I just kind of shut down for a few years.
Yeah. Yeah, I remember your mom telling me how many times waking up in the bedroom, or her waking up to you on the bathroom floor.
Yep.
Now towards the end, you missed a crap ton of school, right? I mean, I remember her. I don't remember what the number was, but it was a huge number. Which, and weren't they even thinking about maybe you'd have to like retake some grades and stuff? I mean,
Yep. So my mom ended up with a pretty lengthy legal battle with the school system from a I missed so many days and
Mhm.
I'm not sure what it is now, but back then I think if you missed 10 days, then potentially you could get held back a grade. But we ended up getting homeschooled. We brought a teacher in, and he
Mm.
would teach me at the kitchen table, and then I played soccer growing up, and it got to a point where I missed so many days. They said I couldn't participate in athletic events, even though I
Mm.
was being homeschooled by an employee of the school district. So, mom got to know the superintendent very, very well, and he got to know my mom very well. And, we call her the Nana. The Nana was, if she's an advocate for you've got the best advocate on the planet. And
Absolutely.
she
Yeah.
fought for me and she fought hard. But yeah, I did. I missed a ton of school. My grades stayed good, but again, I was missing class, and so I was homeschooled. I had friends who would bring me notes, and we didn't have the technology we have today, so it was all handwritten notes. They'd make copies for it, but absolutely, I missed a lot of school, and my mom and the school system they fought back and forth a good bit.
Yeah, so I actually I met your mom for the first time at a Meniere support group that she started because she told me she's like my son has this condition and I started this support group so that I could learn more and I could bring people in that could maybe teach me. She was like dead set on trying to find a way to get you some help and started her own support group just to try to figure out what's going on and what you could do. It was pretty cool.
Right. And so, well, if I don't remember her name, maybe you remember, there's a news anchor that was in town that had Meniere's disease too. And
Yeah.
I
Yeah.
completely forgot about that till just this conversation. But Mom did create a support group.
Mm.
I'm 47 now, which is pretty shocking that all this started back when I was 11. But I feel bad now because I never went to these support groups, and so Mom created it for me, but I never participated because I just didn't want to. Um, I didn't want to go out into the public and talk about it and do these things, and so she went for me on my behalf, and I think she actually turned into a really big support group for people in Charlotte. There was a ton of people have
Yeah.
it. I think you actually reached out to her and said, "I want to come speak at your support group."
Well, actually, what it was one of my patients had Meniere's, and he was the one is like, you need to come speak to my support group, this support group in Charlotte that we have, and I was like, oh, okay. And so he actually was the one who set it up, which is how I met your mom, which kind of gets us. And I was trying to figure out this morning how long I've known you, but I guess it's been close to 30 years now. It was early in my practice that I first met you, actually met your mom first, who then introduced me to you.
Right.
And yeah, so we kind of led up to the point of, you're pretty desperate. Actually, your mom came to me at the support group at the end of the meeting, and she said, actually, she didn't actually bring you in right away. I think she was a little skeptical.
Right.
And finally, she called me about, I don't know, a month or two later, and she said that they had taken you to the biggest Meniere specialist in the country down in Charleston, and they wanted to do streptomycin therapy, which means they would go in and kill the entire inner ear, and you would solely be dependent on your eyes to tell you where you were in space. So, for example, if you woke up in a dark room, you couldn't get up. You wouldn't know which way was up because your eyes couldn't tell you, and you basically would be stuck, right? Or if you went underwater with your eyes closed, you wouldn't know which way to go to get back up to the top, right? So it's pretty big deal. Not to mention you'd be completely deaf for the rest of your life because they would have just destroyed the inner ear. And she's like, I got to get Kevin here. Can you help him? And I'm like, we're going to do everything we can. Do you remember any of that initial
So
experience coming in the
I
office?
had I went to Duke, um, and I had a shunt placed in the back of my ear. When they got
Mm.
to a point where the pharmaceuticals weren't working, they went with the shunt, and apparently the shunt would drain the endolymphatic sac or assist in doing that, which is that's kind of where they think happens with a Meniere's patient is that endolymph fills up, and when it gets full, you have the attack subsides back down, and so that shunt was supposed to help. And this guy at Duke was the world renowned Meniere specialist, and so he put a shunt in my inner ear. I woke up dizzy on the operating table, and I woke up completely deaf from my right ear. And
Oh,
so I've never heard out of that ear since. And so considering that the shunt didn't work, that's when they were going to look at the streptomycin, which is that inner ear injection, which is supposed to kill off the balance nerve, but because they can't. Um, it's not specific enough. Yes, most of the time it will end up killing off the balance nerves and the hearing nerves too.
yeah. That
So,
would have been rough. That
yeah,
would have
and
been a
so we
tough
were a
life.
very active family. We did whitewater rafting. Um, Family lived on the lake, and so we were, swimming in dark waters, floating rivers, pools, that kind of stuff. And the streptomycin was just something that Mom and I talked about, Mom prayed about, and we just decided that it just wasn't an option just because we were that active, and we were looking to pursue something else besides the streptomycin, and that's when you entered and an upper cervical entered, um and just like a lot of people who come into our practices, we're a last ditch effort, and we should have
Right.
been first effort.
Yeah, that's why I always tell people, they usually come in here after they've tried everything else and didn't get results. But the good thing is, we get good results. So
Right.
you were driving in about an hour and a half each way to get to my office at the time up in Mooresville,
Yep.
and your mom started bringing you. And you remember how that started off a little bit rocky. Your mama would kind of question me a little bit.
And so we did. It was Matthews to Mooresville, and she would drive me up there. We would get checked, we'd get adjusted, we'd drive back home, and even that 77 North back then was just
Oh,
loaded with traffic and all that kind of stuff. But
sure.
it did. I remember my first adjustment. No hearing at all. Couldn't hear a lick. And I distinctly remember you going over my films, pointing out the misalignment,
Yeah.
and you look at me, you go, "Does that sound good?" And I'm like, "I don't know." And so you basically started doing your own version of sign language, like, "Look, come down here, get
Yeah.
situated, turn your head this way."
Oh, I remember. I felt like I had just done this incredible report of findings. Like, look at this and here, and look at it. And you're looking at me the whole time, kind of nodding. And I'm like, see, these bones are over here, and this is putting pressure, And then finally, I'm looking at you, and I'm like, okay, does that sound good to you? And you're just finally like, I didn't hear a freaking word he said.
I didn't hear a
I'm like,
word.
yeah, I was like, all right, get on the table.
No.
Let's see what we can do.
I will say though, post resting, right? We post
Mhm.
rested, and back then your office, I'm not sure, was it 3, 4 rest beds maybe? It was a
Yeah,
smaller practice,
yeah.
but
I had
uh,
4 rest beds.
right, we were late in the afternoon, and so because it took us mom's work, school, whatever, it was late in the evening, and I remember driving down 77 and sun and going down and all of a sudden I couldn't hear anything. Tinnitus just all encompassing and then boom, it's gone. And I told mom, I was like, I don't know, something happened. Like I could hear, tinnitus
Yeah.
is I could hear the roaring of the cars going by me. I could hear my mom talk to me. I could hear the radio on just a little bit. Um, and so that was that first experience of whoa, we're on to something here. But you're right, it was rocky. I got that initial relief. I got that light at the end of the tunnel got a little bit bigger, but it was a roller coaster ride. There were ups and downs, and you told us that was coming. We knew we were going to have those good days and bad days, and I remember you just repeating to me over and over. And I still do the same thing with my patients. We're looking to replace bad days with good days, and eventually the good days to take over the bad days.
Yeah.
And it
Yeah. It's a
did. It
process.
was a rough time.
It didn't happen overnight. So, unfortunately, people are used to the drive-through medical profession. You drive through, you get a prescription, you take a pill, you feel better, right? Well, it doesn't fix anything. It just masks the problem. And real healing, it takes time.
Absolutely.
But if you stick with it, eventually you're overcoming it. So, it literally changed your life, which is what happened to you, which kind of then led you to where you are now. So give me a little idea, or give us a little idea, what that looked like. I know at first you had no plans of being an upper cervical doctor, but eventually things kind of
And so,
changed. So what happened?
let's see, fifth grade was when I got that first Meniere's attack. So it's like fifth, sixth, seventh, and eighth grade were just rough. That's
Yeah.
when I was going through all the homeschooling, the issues with the school system, that kind of stuff. Ninth grade started to show a little bit. 10th, 11th, and 12th grade were each year just drastic improvements.
Hmm.
Um, and one thing that I'm going to touch on that a lot of people deal with that come into our offices is like there's a psychological part to having a condition. And so with Meniere's, like I got to a point I didn't want to leave the home. I didn't want to be around somebody who didn't understand me. I didn't want to be in public in case that I had a Meniere's attack. And so,
Hmm.
for instance, I went to a hockey game with my dad, had a Meniere's attack. So instead of telling my dad I'm dizzy, I stand up, go up the steps, and start walking towards a bathroom. End up at the furthest bathroom away from my dad. Go into a stall at the hockey arena. I can't remember the name of the hockey team there in Charlotte, but laid down
Checkers.
on checkers, laid on the floor. And finally, there was a guy using the bathroom next to me, and I had to grab his ankle. And I remember him just barging through the door, drop shoulder, because he knew there was a kid down there having a problem. Ambulance came in. Finally, my dad comes in and he's like, Kevin, like, what are you doing? There was a bathroom right next to our seats. It's taking me 30 minutes to find
Right.
you. But those type of
Uh,
situations, scenarios happen to everybody, and it creates an anxiety about being out in public. So you get depressed and all that
yeah.
kind of stuff. So moms are, the Nana, we call her, like I said, but Nana's biggest thing was like, just put your boots on, and every single day you got to go, you got to go, you got to go. And if it wasn't for her, there's no way I am where I'm at. But each year she just kept preaching the same thing. You got to put your boots on. You got to get up, go to work, go to school, do what you got to do. And we ended
Uh-huh.
up 12th grade, I think, was actually good. Like I don't remember um, a ton of issues in 12th grade. Like I made it through senior year pretty good. I mean, without you, without upper cervical, I don't even have a prayer to go to college. I ended up going to Western Carolina, majoring in
Well, now,
criminal
did,
justice, minoring in
didn't you
chemistry.
play on the? Didn't you play on like your high school soccer team and stuff? Everything your high
Oh
school
yeah,
year?
oh yeah.
Didn't y'all put
Well, that
y'all?
was part of the
Didn't y'all?
whole superintendent talk. So we ended up. I played on the team my senior year. We ended up winning the state championship, and so that was.
Yeah, that's what I thought. That's great.
Yep. And so Meniere's kind of started to take that away from me. And then through mom and you and upper cervical, it kind of gave me that back. And it all kind of came to that peak of winning the state championship my senior year. Um,
That's great.
just a super cool moment, but absolutely. And
Yeah.
then going to college after that, and that just wouldn't have been possible without it. But no, upper cervical chiropractic wasn't something I considered doing as a career. I actually was going to do. I majored in criminal justice, minored in chemistry. I was going to go to medical school to become a pathologist. If you remember, um, I wanted to uh, basically just work with the dead people. I wanted to find out why they died. I wanted to do autopsies and stuff like that. Um,
Yeah.
and so college was good. I didn't really have a ton of issues, but because I was 3 hours away from you, getting checked and adjusted. And just like the majority of our patients, when they start to feel good, they start to get a little bit more confidence, and sometimes they don't do the things that they did to get them better. And so I did start to have a few issues like in my junior year, I think. So I was making more trips back to you. And I don't know if you remember this or not, but you looked at me and you're like, "You still plan on going to medical school?" And I was like, "Yeah, I want to be a pathologist." And you're like, "Dude, why are you not being an upper cervical doctor?" I was like,
Mm.
I don't know. Like, it never crossed my mind. He was like, "You're a walking testimony."
Yeah.
He's like, "You realize you can work with the living instead of working with the dead."
Yeah.
And if you hadn't have said that one statement of, you can work with the living and not work with the dead, I don't know that I would have gone to chiropractic school.
Well, it's funny you say that because you just said the difference between medicine and chiropractic. Medicine studies what causes people to die,
Yep,
and chiropractic is more the study of what allows people to live. Right?
absolutely.
They treat disease and conditions and try to keep people from dying, and we actually study the body and health and try to keep people healthy. So then you don't have to worry about dying. We get ahead of the. That's the biggest difference I think between us and traditional medical care. And so yeah, I think so. I think you made the right choice, huh?
Oh, absolutely. But again, I think it was that one sentence. You can work with the
Okay.
living instead of working with the dead. I think that was the 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 push forward that just pushed me to do it. And so I re-geared my junior year. I had some what's the word, the prerequisites that you had to take to get into
Uh-huh.
chiropractic school. And then you got me started asking about chiropractic schools. I think you went to Logan or Palmer or Sherman,
Yeah.
and we made the decision to go to Sherman just so you could continue to take care of me, just because it was an hour down the road.
Well, that was good. So, you know, chiropractic, especially upper cervical, is, I always said it's not really a profession, it's more of a lifestyle, right? And
Oh, absolutely.
so, if you compare the traditional family compared to the family of an upper cervical family, it's a little different, right? I mean, how do you think, knowing what you know now? I always say when I do my classes, all the years I spent in school, it was all worth it if I never practiced today, just because of the effect it has on my family, being able to take care of them, keep them healthy. And I know you've got a busy practice. First of all, I want to thank you for coming in on a Saturday. I mean, we have to squeeze it in when we can. You have two all-star kids, college athletes. So how do you think that being an upper cervical family, what do you think is different, compared to traditional medical
So,
families? I don't know what you call them. People who don't live like we do.
right, I mean, it's standard American. It's kind of like a standard American diet. It's standard American healthcare. Like that's how they were
Right.
born. That's how they were raised. They don't necessarily know different. I think innately, a lot of people feel like this can't be the way, but they also
Yeah.
realize I don't know enough to create a new way. And I think that's part of mine and your job and everybody else that's in this field is we have to educate as many people as we possibly can and spread that word. But I mean, for my two boys, they were, my wife is again, she was in that standard American healthcare family, and so she didn't realize that things could be different. And so,
Right.
that's an interesting conversation in and of itself. She had to kind of learn chiropractic, and I remember, she used to bring me to appointments once we started dating the junior year in high school. So she would bring me to your office. So you've known her
Oh
just
yeah.
as long. And so with you and me and talking and just educating, it kind of diverted us, and we went down that new path of health. And so both my boys were born. They have led drug-free lives. Neither one have been on an antibiotic. Neither one have been vaccinated. They've been under upper cervical care their entire life. I've got videos of you checking and adjusting Harrison and Walker, my youngest.
Mhm.
Neither one of them they never dealt with colic, ear infections, digestive issues. They never missed a day of school from kindergarten to fifth grade. Harrison maybe made it to seventh grade. Um, and so they've just led different lives. They don't understand um, a pediatrician appointment every 2 months just
Right.
to check to well checks. And I think the only shot Harrison's ever had was a steroid because he got some poison ivy all over him. It's like he just rolled in it. That's the only thing he's ever done outside of just chiropractic and eating healthy and exercise. And so it really is. It's interesting, and we have to have conversations with our kids about things that go on outside of our control. And we have to say, look, we're raised just a little bit differently. You have to view the world differently. Their friends are sick, or they always have sinus infections or
Mhm.
conditions. And so they always ask questions. Why are we that way? Why do we live this way? And I'm like, look, talk to your buddies. Tell them what you've done to be healthy.
Yeah. Yeah, it is a different lifestyle. And our kids don't really realize that, most people don't live that way. Most people, every time you get a cold, you take a drug. Every time you have some ache or pain. And our kids don't do that, and they never have. And now they almost never, ever, ever even get as much as a cold. They're like the healthiest kids on the block, and they just assume that's the way it is. And then one of their kids is like, oh, they can't do this. Because they're sick. What does that even mean? That's just an excuse, right? Like,
Right.
well, no, people get
It,
sick.
it is.
It
It's
was
hard for them
great.
to kind of comprehend that too.
Yeah.
It's
Right.
difficult.
I mean, and this week was special to me because I know we both your son Harrison came in and spent the week with me. He's
Yep.
a senior in college and looking to go to chiropractic school, and so he came in and spent the week with me, observing and kind of following me around the office, which was pretty cool. I remember you coming in, I think you're probably 14, 15 years old or something when you first came. And yeah, your wife Jill brought you a lot of those times, especially towards the end, because you couldn't drive and she could. But then to now see, your son, which again, I remember when he was born and giving him his first adjustment, now looking to be able to carry it on and do that again. So a ripple effect is pretty proud. I'm a proud, I don't know,
Uncle Ray.
friend, doctor,
Uncle
right?
Ray.
Right? That I was able to change direct you in that lifestyle, and now he's going the same direction. And then, of course, my youngest, she's on track to do the same thing. So, we're making a difference, one doctor at a time, but it's cool.
It is. And yeah, and they kind of grew up together, and
Yeah.
they kind of knew that when they're all four together, it's a different interaction. You know what I mean? Like
Oh
they
yeah.
they all come together. But
Yeah.
It really was super cool. Harrison had a great time with you. He loved the interactions, the patient communication, and he's trying to figure out uh, his chiropractic journey. But I think he's definitely solidified on chiropractic, and that's
Yeah.
just super cool. That's a testament to you and to me and
Thank
how they were
you.
raised, and
Yeah, yeah. He told a lot of our patients, like, so what's your plan? What are you doing? Where are you going? He said, oh, well, I'm definitely going to be a chiropractor, and I'm just trying to, I'm just looking at schools and trying to figure out exactly what direction to go. So that's cool. That's pretty
yeah.
awesome.
No, it's great. I couldn't be more proud. And even if he didn't want to be a chiropractor,
Yeah,
my younger son kind of wants to follow my original footsteps and criminal justice and that kind of stuff. And I'm super
cool.
proud of him for following that.
Sure.
But it is neat to see him kind of just gravitate towards that and see how he's going to be able to help produce health and carry that on and just your youngest and Harrison, we got to have somebody to take care of us down the road.
Absolutely. Yeah, yeah, it's great. It's awesome to see that follow up. Um, so when I wrote my book, uh, Best Kept Secret in Healthcare, we actually interviewed your mom, and at the end of one of the chapters is her story of you, which gives a whole different perspective than your
Right.
story about the concerned mom and how determined she was, to find help and how she did. And it's really cool. So if you don't have my book, pick up the book. There's several stories like that, but her perspective is a little different than Kevin's. But it's really awesome.
Yep. I've
So
actually got your book right behind me.
say again.
Your book's right behind me.
I can't see. I'm blind.
You got your book over there.
Oh, okay. I see now. That's cool. Well, so there be people, watching this podcast that maybe don't, have never even heard of upper cervical before. And what would, for those that have never heard of it, or maybe they're suffering from some health condition they haven't had relief from, like we said, we're always the last place people go.
Right.
What would you say to anyone watching? I mean, I know as a doctor we do this every day, but hopefully there'll be some people here that maybe we can reach and we can guide them in the right direction.
Right. And so social media today is kind of filled with saunas and cold therapy and exercise and eating right and nutritional stuff and stress relief and all that kind of stuff. And you can do all of that. But if you have an upper cervical misalignment, you will never be the healthiest version of yourself, period.
That's right.
And so you can do all the stuff and you may be okay, but you'll never be the healthiest version of yourself. So if you're looking to be the healthiest version of yourself, the upper cervical misalignment has to be taken care of. So one analogy I use with all my patients is we maintain everything in our life, our relationships, our vehicles, our homes, and all of those things, right? Cars, homes can be replaced. The
Right.
spine is the thing that can. And so we have to maintain the structural stability and the neurological stability of our bodies. And we do that through upper cervical. And so, if you're out there and you're dealing with any condition, I have patients ask me all the time, can you help patient Y with condition Z? And I said, look, if they have an upper cervical misalignment, I can remove that misalignment and allow their body to function the way God intended it to. Yes, I can help them because we can remove that variable and allow their body to handle that condition better than it was with the misalignment present.
Right. Yeah. 100%. Just the mere maintenance factor. A lot of our patients, I have patients been coming to me, like you, 25, 30 years, still come in just to get checked every now and then. Because once you get to live the standard of life that you're designed to live, you want to maintain that. Like you go to the dentist, and get your teeth checked all the time.
Yep.
And again, people can live with no teeth, but you can't live without a proper nerve system. All right, that controls
Right.
everything. So, getting checked, to see if there's a problem. Hopefully, maybe there's not, but if there is, getting that corrected, you don't even know what your full potential is until your body is functioning at 100%. Then you'll know, and it's a different lifestyle.
It's a completely
It's a,
different lifestyle. And then,
yeah,
like we talked about earlier, that healing takes time, right? And so once you get that momentum moving forward, then it's kind of hard to stop that train. And so Most people come in, they don't know they have an upper cervical misalignment. They're moving in the wrong direction, and their momentum is carrying them in that wrong direction. And upper cervical, sometimes it takes a long time for that momentum to be slowed down, stopped, and start moving back in the correct direction. And some people, they stop quickly and they move back forward. And so you just got to remove the upper cervical misalignment and allow your body to function the way God wanted to. I know I said that before, but that's ultimately what we do.
Absolutely. Yeah. We move the bone. God does the healing. It happens no other way. Never been
Absolutely.
never been anyone heal anyone of anything. So except for you. Well, Dr. Broom, I appreciate you hanging out with us today. It's taking
Thanks
time
for having me.
on a weekend away from the family, and this was great information. I know your story is an incredible story. Hopefully, it'll get out to a lot of people. Any parting words before we pass on, or not pass on? Hopefully,
Right,
we
right.
move on.
Moving on, right? We're all heading that direction. We just don't
There
want
you
to
go.
get there today, right?
That's right. Not
Oh,
anytime soon, though. Hopefully.
yeah, right. And it's just that. Like if you're dealing with something and that burden is laid on top of you and you don't see an end in sight, there's no light at the end of the tunnel, and you've tried this and you've tried that, and they say that you have to live with that condition, just reach out to one of us and let us see if we can
Yeah.
find you an upper cervical chiropractor near you. Come see one
Yeah.
of us, and let's just see if we can get your your momentum shifted and move back in that other direction. And
Perfect.
and again, thank you to you. If it wasn't for you, if it wasn't for you for stepping out of your comfort zone and coming to that Meniere support group meeting, and if it wasn't
Yeah.
for your due diligence of educating my mom through the ups and downs in the beginning, I wouldn't be where I'm at today. And so, big kudos to you for doing that, and you've done that your entire career, and you've helped
Yeah.
thousands,
Well, I've
thousands,
always said
thousands of
our
people.
own. I've always said our only competition is ignorance, and that's hopefully the podcast, the book, these things will help get that message out there. So if anyone, you're in Anderson, South Carolina, if anyone wanted to find you, what's the easiest way to do that?
We're at onetemplewellness.com, and that's our
One
social
temple.
media. Yep, onetemplewellness.com, and that's our social medias. You can reach out and contact us that way, and we'll be more than willing to help you, or see if we can find somebody to help you. I probably talk to 2 to 3 people a month on the phone, most with Meniere's, and we find them somewhere to go.
Yeah. Good. Well, you might have more after this goes out, so that's
Yeah,
good. So
absolutely.
yeah. So if you please, if you find out something that resonates with you on this podcast, please share it. Our objective is just to help as many people as we can. Whether they come to us, we can find them another doctor, another part of the country,
Yep.
another part of the world. And we appreciate you tuning in. And Dr. Broom, one more time, I appreciate you being here. And hopefully this will get out and change some lives like yours got changed.
Absolutely. That's all we can ask for and pray for.
That's right, bud. All right, man. Thanks, sir. And we'll see you. Hopefully we'll hook up again on another one of these before long.
Let's do it.
All right, bud.
Take
Thank you.
care.